Hello guys, welcome back, and I hope you all are doing absolutely fine. So in this video, we'll be covering obstetrics important pointers for Theraps of the Obstetrics paper 2. So in this video, we'll be covering all the important previous year's 2 markers, some important pointers which you need to remember for different remedies for different conditions. And yeah, I hope this video helps you all out. I'm sure it will help you because it will be very handy for you all to revise all the important therapeutics question under one go in one roof. So without much ado, let us begin. Chelidonium in neonatal jaundice. Jaundice due to hepatic and gallbladder obstruction, liver is enlarged, tongue is large, flabby and yellowish, diarrhea and constipation alternates, hard round like ball, like sheep's dung, bright yellow clay colored stool. Urine is profuse, foaming, yellow like beer. Skin is also yellow. Natrum self in neonatal jaundice. Tongue is coated brown. There is vomiting of bile. Liver is sore to touch. Hepatitis, diarrhea. Yellowish greenish watery stool. Urine is loaded with bile. Urine contains brick dust like sediment. Skin is yellow. Argentum nitricum in ophthalmia neonatum. There is purulent ophthalmia, swelling of conjunctiva, eyelids are sore and swollen, ulcer of eyelid, ulcers in the cornea is opaque, pupils are dilated, and inner canthi is red and swollen. Merksol in ophthalmia neonatum. There is profuse acrid discharge, lacrimation is present, eyelids are red and swollen, there is also iritis. So guys, before we begin the next pointer, I want to make sure one thing, that these are some important pointers which you need to know and a bare minimum. Alright, so these are the minimum things you can write in your 2 markers. You can always improve it, improvise it, better it by referring different books which you might refer. But before your examinations, or if you don't have time to again go through all the books, you can always revise these points from this video. So yeah, that was that. Now let us continue. Antimonium tart in asphyxia neonatum. It is an excellent remedy for asphyxia neonatum. The cause of asphyxia is mechanical foreign body. Child is pale, breathless and gasping. Face is cold blue and pale covered with cold sweat. Tongue is coated thick white with red papillae. The child vomits until he faint. There is rattling in the chest. Arnica montana in asphyxia neonatum. It is a good remedy for asphyxia neonatum. The cause of asphyxia is injury. Cough in sleep without waking, cough produced by weeping, cough causes epistaxis, and pulse is feeble and irregular. Aesculus in piles during pregnancy. Pile is blind, purplish and painful, burning and itching in rectum. Rectum is dry, sore with fullness, sensation as if rectum is full of small sticks, knife-like pain shoots up the rectum. Collinsonia in pile during pregnancy. Painful bleeding pile. Pile alternates with heart complaint. It is a good remedy for constipation and pile during pregnancy, vascular engorgement of the rectum, sensation of sticks in the rectum, itching in the anus. Carbo wedge in varicose vein during pregnancy. It is suited to fat, lazy and sluggish patient. Venous congestion, blood stagnate in the capillary, causes blueness, coldness and ecchymosis, bluish skin and cold limb. Cramp in the sole, feet are numb, sweaty and cold from knee down. Tendency for varicose vein, varicose ulcer, offensive discharge from the ulcers. Modality, it is aggravated by heat of bed and in the evening. Hemamelis in varicose vein during pregnancy. It acts on the coats of the vein, causing relaxation with engorgement, dilated, elongated and tortuous veins of lower limbs. Veins bleed easily, bluish knots in the lower extremities with bursting sensation. Tendency for varicose veins and varicose ulcers. Ulceration of the varicose veins. Arsenicum album in hyperemesis gravidarum. Gastric derangements after cold fruits, watery fruits, vegetable diet, decayed food, alcohol, nausea and vomiting, cannot bear the smell or sight of food. Very important keynote of arsenic. Cannot bear the smell or sight of food. Craving cold water, but it is vomited out. Craving acid sour things, milks and coffee. Unquenchable thirst for cold water. Thirst for small quantities at short interval. Great restlessness and fear of death. Thinks it is useless to take medicine. Modalities aggravated by midday and midnight, which is very keynote of arsenic, which is 12 to 2 am pm. Ipecac in hyperemesis gravidarum. gastric derangements after indigestible food and raisins. There is persistent nausea and vomiting. Persistent nausea, not better by vomiting, thirstlessness, craving for sweets, increased salivation, tongue is clean. Colchicum in hyperemesis gravidarium. Nausea and vomiting occur from smell of cooked food, especially fish, egg or meat. Vomiting of mucus, bile and food. Great coldness in the stomach. Craving for various things. Hungry but no appetite on looking at the food. Profuse salivation. Symphorecarpus in hyperemesis gravidarium. There is persistent vomiting, nausea, water brash and bitter taste in the mouth. Constipation, tendency to constipation. Aversion to all food and modality, the patient is better by lying on the back. Thyroidinum in agalactia. Agalactia, tendency for memory tumor and uterine fibroid, tendency for puerperal convulsions and insanity. Pulsatilla in agalactia. Scanty or suppressed milk. The breasts are sore with aching lumps. Mother cries every time the child is put to the breast. Asafoetida in galactia. In agalactia. It is suited to hypochondriac hysterical females, deficient milk with oversensitiveness. Lac canandum in agalactia. It is a good remedy for agalactia and galactoria. It dries up the milk in women who cannot nurse the baby. High potency. In high potency, it dries up the milk especially during weaning. In low potency, it helps to increase the milk secretion. Pulsatilla in anemia during pregnancy. Anemia after quinine or abuse of iron tonics. It is suited to mild, gentle, plethoric females who have yielding disposition and cry easily. Shortness of breath, anxiety and palpitation. Palpitation from emotions with amenorrhea. Never well since puberty. Chilliness, short breath and cough which is aggravated by lying on the left side. China in anemia during pregnancy. Anemia from loss of vital fluid, hemorrhages, face is pale, hypocratic, eyes are sunken and surrounded by dark rings. Liver and spleen are enlarged. Dropsy after loss of fluids and hemorrhage. Dislike for mental and physical exertion, nocturnal diarrhea. Ferrum metallicum in anemia during pregnancy. Anemia from loss of vital fluid, hemorrhage. It is suited to females who have pseudoplethora, flushed face and cold extremities, weakness from speaking or walking, pallor of skin and mucous membrane, dropsical swelling of hand and feet, craving for tomatoes and bread, vomiting of liquid, solid food is retained. Pulsating headache, chest is oppressed and breathing is difficult, dyspnea ameliorated by walking and speaking, voracious appetite or loss of appetite. So remember that the ones which are covering different and many points can be also be asked for 5 markers, and all the 2 markers which you are reading it here and remembering can be also be there in the 5 markers part as well in the beginning. Alright, so it is very important for us to remember it all. Natrum mur in anemia during pregnancy. Anemia from loss of vital fluid. Emaciation is especially marked in neck, blue ring around the eye, weakness felt in the morning in bed, dryness of mucous membrane, bursting type of headache, heart's pulsation shakes the whole body. Cantharis in retained placenta. It is a good remedy for retained placenta. It expels moles, dead fetus and membranes for puerperal metritis with the inflammation of the urinary bladder, constant discharge from the uterus. Colophyllum in retained placenta or abortion. It is a good remedy for habitual abortion. The uterus cannot hold the baby. Retroverted uterus. There is passive type of hemorrhage. Blood oozes from relaxed vessels. Bleeding is dark. Erratic pain. Needle-like pricking pain in cervix. Rheumatic complaints of small joint. Sabina in retained placenta or abortion. It is a good remedy for 3rd month's abortion. For threatened abortion. It expels moles from uterus. Bleeding is partly fluid and partly clotted. Pain radiating from sacrum to the pubes. Modality aggravated by heat motion, better by cold fresh air. Sickle core in retained placenta or abortion. It is a good remedy for 3rd month's abortion or for threatened abortion and septic abortion. Burning pain in the uterus. Burning sensation as a spark of fire on the skin but externally cold to touch. There is passive type of hemorrhage. Blood oozes from uterus. Bleeding is dark, fetid and protected. It helps in retraction of the uterine muscles. It helps in emptying the contents of the uterus. Trillium pendulum in PPH, which is postpartum hemorrhage. There is pale, faint and dim light. Sensation as if hip and back were falling to pieces. Bleeding is bright red and profuse. Active and passive hemorrhage from uterus is present. Sickle core in PPH. It is a good remedy for postpartum hemorrhage, for third month abortion, for threatened abortion, burning pains in the uterus, burning sensation as if sparks of fire on the skin but externally cold to touch. There is passive type of hemorrhage. Blood oozes from uterus. Bleeding is dark, fetid and protected. China or cinchona officinalis in PPH. It is a good remedy for postpartum hemorrhage. It is suited to weak, oversensitive nervous women with Hippocratic face. There is faint and loss of sight. Bleeding is dark, profuse and clotted. Hemorrhage is long and continuous. There is headache after hemorrhage. Mentally she is apathetic, indifferent, taciturn and gloomy. Pulsatilla in PPH or abortion. It is a good remedy for postpartum hemorrhage. It is useful in uterine placenta. It is suited to primigravida with weak labor pains. Nervous, shy and weepy female. There is soreness of the abdominal muscles. Bleeding is thick, dark and irregular. Uterine contraction are not coordinated. Cecal core in APH. It is a good remedy for postpartum hemorrhage and antepartum hemorrhage, for third month's abortion, for threatened abortion, burning pain in the uterus, burning sensation as if sparks of the fire on the skin but externally cold to touch. There is passive type of hemorrhage. Blood oozes from uterus. Bleeding is dark, fetid and protected. Arnica montana in APH. Ailments from injury, fall, blow, bruises, shock, overexertion. For threatened abortion. Blood vessels are relaxed, black, blue spot with a tendency to hemorrhage. Sore, lame and bruised feeling after the bleeding. Arnica has an absorbent action. It acts as a prophylactic remedy for pus formation. Urine is involuntary and dribbling. Retention of urine after labor. Fear of being struck. Belladonna in APH or abortion. It is a good remedy for antepartum hemorrhage, congestion, throbbing and dilatation of the arteries with burning heat, severe and sudden neuralgic pain, pain along the nerve especially in the neck. Bleeding is hot, bright red, profuse and easily coagulable. Hot and tender vagina, spasm, shock and twitching of the body, cutting pain from hip to hip. Mentally, the patient is an angel when well and devil when unwell. Rustox in APH. Ailments from overexertion, sprains, after midnight, cold air, pain mainly on the right side, sore bruised sensation. There is pain as if a muscle was torn from the bones. Bleeding is rusty, red and acrid. 4 homeopathic drugs for abortion. Sickle core, sabina, colophyllum, belladonna and pulsatilla. 2 remedies for threatened abortion. Sickle core, sabina and belladonna. Cicuta virosa in eclampsia, convulsions plus coma. Ailments from brain injury suppress eruption, touch, noise. Convulsions are violent. There is very frightful distortion of the limbs and the whole body. Convulsion extends from center to periphery, loss of consciousness, opisthotonus and spasm of the diaphragm. The patient screams, the face is red and blue, jaws are locked. Craving for indigestible things such as chalk, coal and charcoal. Frequent suspension of breathing. Cuprum met in eclampsia. Ailments from suppressed eruption, suppressed discharges, fright. Convulsions, cramp and spasms are violent. The convulsion extends from periphery to center. Convulsions with blue face and clenched thumb. A strong sweetish metallic taste in the mouth with flow of saliva or and salivation. Constant protrusion and retraction of the tongue like a snake. When drinking, the fluids descend with a gurgling sound. Gelsemium in eclampsia. Ailments from fear, fright, exciting and bad news, hysterical convulsions. There are dullness, dizziness and drowsiness. There is complete relaxation and prostration of the whole muscular system, tremor all over the body, twitching of the muscles, paralysis, dim vision and double vision, thirstlessness and feeling of great tiredness in the entire body and limb. Stemmonium in eclampsia. Ailments from suppressed eruptions, suppressed discharges, fright, convulsions with consciousness. During delirium and convulsions there is twitching of single muscle or group of muscles, especially of the upper part of the body. The patient always sleepy but cannot sleep. Face is red and hot with cold hands and feet. Eyes are wide open. Pupils are dilated. desire light and company, and averse to dark and alone. The patient has fear of water, great aversion to liquid. Apis mellifica in preeclampsia. Ailments from fright, rage, jealousy, bad news, bag-like swelling below the lower eyelids. Lids are red, edematous with burning and stinging pain. Skin is waxy, pale and edematous. Edema of labia and right ovary. Urine is scanty, frequent and coming only in drops. Last drop burns. Thirstlessness, weeping desperation. There is stinging, burning, lancinating pains. Modality aggravated by heat, touch and better by cold and uncovering. Kali carp in preeclampsia. Ailments from cold air, ice cream, ice water, bag-like swelling between the upper eyelids and the eyebrows. Urine is foamy with thick red sediment. Increased sweat, backache and weakness. There is a great fear of being alone. The patient is very much oversensitive to touch. Modality: by lying, aggravated by lying on the left side, touch and between 2 to 4 am. By warmth, better by warmth. Arsenic album in preeclampsia. It is suited to female who is lean, thin and debilitated. Swelling of feet is present. Urine is scanty and burning. Albuminuria. Urine is black as if mixed with dung. Skin is waxy and pale. Thirst for small quantity of water at short intervals. Modality aggravated by ice cream, cold fruits, alcohol, tobacco, quinine after midday and midnight, and better by hot application. Colophylum in normal labor, false labor pain. Ailments from pregnancy, parturition, lactation, needle-like pricking pain in cervix. Pains are intermittent, paroxysmal and spasmodic. Weak, irregular and useless pain in the beginning of labor. This remedy helps to produce efficient pain. Delayed labor due to spasmodic rigid os. Tendency for hemorrhage. Postpartum hemorrhage after a hasty labor. Semicifuga in normal labor, false labor pain. Ailments from anxiety, fright, disappointment, love, labor. Pains are violent, electric shock-like and goes side to side or upwards and downwards along the thighs. Pains are associated with cries and faint. Shivering in the first stage of labor. Alternate tonic and chronic spasm. Rigid os. After 2/3 pain is over, pain goes to the back region. The uterus feels sore, heavy, bruised and aching. This is remedy given in the last month of pregnancy. It shortens labor, cures sickness of pregnancy. Modality aggravated by rubbing the back area and by warmth. Pulsatilla in normal labor, prolonged labor and inefficient labor. Ailments from pregnancy, fatty and starchy food, quinine, ice cream. Difficulty, irregular, sluggish labor pain. Patient bonds door and windows open during labor. Wandering pain associated with chilliness, thirstlessness. Weeping associated with labor pain. Modality aggravated by warmth evening, better by cold and open air. Chamomilla in normal labor. Ailments from anger. Unbearable pain, she sends the doctor and the nurses away but calls them back later. Labor pains are irregular, go up or down the thigh. Pain associated with numbness, spasmodic distressing pain, irritability associated with pains. Modality, it is aggravated by heat. Kali carp in normal labor, prolonged labor or inefficient labor. It is suited to female who have a history of abortion in the 3rd month. Females suffering from backache, leukorrhea and weakness. The labor pains are inefficient. The pain is felt in the back and traveling to the thigh. The pain settles in the back, so patient wants her back to be rubbed. Rust talks in backache. Causation: in summer bathing in river or lake, lying on damp ground. Location: between shoulders and small of the back. Sensation: pain with stiffness, pain on swallowing. Modality: aggravated by sitting and lying, and the patient is better by motion. Remedies for backache: Rustox, Kali carp. Remedies for prolonged labor, inefficient labor, Pulsatilla, Kali carp. Remedies for false labor pain, Colophylum, Semicifuga. Digitalis in heart disease during pregnancy. Weak heart without any valvular complications is a keynote of digitalis. There is uneasiness in the region of the heart and precordium. Heart's action is feeble. Frightful stitches in the region of heart, coming on every 15 minutes and lasting for 5 seconds. Pulse is weak, slow and intermittent. Sensation as if heart would stop beating if the patient moved, and face is pale and blue. Lachesis in heart disease during pregnancy. There is violent palpitation of the heart, constrictive feeling in the chest with precordial pain, Precaudal region is very painful and sensitive to touch. Suffocation on lying down, unable to lie on the left side with fainting and anxiety. The patient wants to be fanned but slowly and from a distance. There is blue and purple look of the body with cold sweat. Remedies for subinvolution of uterus: Colophylum for retained placenta and Sickle core for retained placenta. Stemmonium in puerperal psychosis. Stemmonium is one of the trio of delirium ailments from suppressed secretion and excretion. Loquacious laughing, singing, rhyming, swearing, praying. There is religious mania seen in Stemmonium. There is strange delusion about her own identity. She thinks that she is very tall, double or half of the body is cut. Sensation as if limbs were separated from body. The patient feels that she is seeing ghosts and dangerous animals, hears strange voices and talks in an unnatural language or a foreign language. Patient wants and desires light and company. Patient has disposition for praying, beseeching and entreating. During delirium, the patient gets up and wants to escape. He runs away and hides himself in a corner. Patient is furious. He has imagination that she is many persons. She is lying crosswise ahead. Crosswire, her head is in many places. She cannot bear solitude and darkness. So this question in a way covers the mental symptoms of Stemmonium, a 5-marker for Materia Medica's paper. Belladonna in puerperal psychosis. Belladonna is one of the trio of delirium. The patient is very delirious with constant cerebral congestion. Persistent and violent delirium. There is strange delusion, illusion and hallucination. The patient feels that she is seeing ghosts and dangerous animals, dogs and wolves. Hot red face, throbbing of carotid, redness of the eyes. During delirium, the patient gets up and wants to escape. She runs away and hides himself in a corner. Patient is furious. She spits, bites and strikes those around her. She uses absurd language. She picks up bed clothes, tear clothes to pieces and throw. Hyoscyamus in puerperal psychosis. The mania of this remedy is midway between the belladonna and stemmonium. The patient is very restless. She cannot stay in bed. She jumps out of the bed and there is desire to escape. Suspicious and jealousy runs throughout the remedy. Muttering delirium, she talks to imaginary person or dead people. She makes irrelevant answer and thinks that she is in the wrong place. Lascivious mania, persons remove and the clothes and exposes her genitals. Sings obscene song. Stupor and unconsciousness. Fear of being alone. Fear of being poisoned. Fear to eat or drink. Platinum in puerperal psychosis. Ailments from fright, grief, vexation. Hysterical and proud female. Superiority complex. She imagines that she is born in a high family and all other are of the lower category. She thinks everyone physically and mentally are smaller than her. Anxious and serious over silly matters. There are hysterical patients who alternately are happy and sad. One moment excessively happy and the next moment sad. She can cry easily at any moment. There is fear of death with loathing of life. Mental symptoms appear as physical symptoms disappear and vice versa. This is the keynote. There is excessive sensitiveness of sexual organs. Coition is impossible since increased sexual desire which leads to masturbation. Nymphomania is also seen in the puerperal state. Apis mellifica in puerperal pyrexia. Fever. Chills begin at 3 p.m. with thirst. Fever is continuous and low type. Patient desires to uncover. Sleep after fever paroxysm. Burning heat. There is stinging pain during urination. Urine is scanty, coming only in drops. Last drop burns. Arsenicum album in puerperal pyrexia. Chill begins at 1 to 2 a.m. and 12 to 2 p.m. with thirst. Sleep during night before paroxysms. Burning heat. There is sweat at the end of the fever. Unquenchable thirst. There is great debility and restlessness. Patient thinks that she is incurable, the disease is fatal and it is useless to take medicine. This remedy is useful in septic fever. Baptisia tinctoria in puerperal pyrexia. Chill begins at 11 a.m. in the morning. Rapid onset of fever. Temperature ranging from 103 degree Fahrenheit to 106 degree Fahrenheit. Sore limb and bruised feeling, but she cannot move because there is a lot of weakness. First the tongue is white coated with red papillae in the middle. Later tongue is dry, cracked and ulcerated. Sweat, urine and stools are offensive. Patients There is aversion to mental exertion. She thinks that she is broken and part is separated, so she is trying to put them together. She sleeps in the middle of an answer. Aconite in puerperal pyrexia. Sudden acute fever is a characteristic keynote of this remedy. Chill begins in the evening and at night with thirst, sudden onset of fever, burning heat, there is high fever, there is drenching sweat on the covered part, there is thirst for large quantities of cold water, patient has fear of death, she predicts the time of death, patient is very much restless, patient has a lot of anxiety. Lachesis in lochia. It is suited to females who have blue and purple look, chilled with sweat, great sensitive to touch, even the touch of clothes causes uneasiness. Lochia is dark, discharges are offensive, great loquacity, jumps from one topic to another, she is suspicious and jealous. Pyrogen in lochia. It is a great remedy for septic fever, temperature ranging from 103 to 106 degree Fahrenheit, chilled with sweat. Lochia is thin, acrid and fetid. Discharge is very offensive. Patient is very much restless. Creosote in lochia. It is suited to females who is tall and slender. Lochia is dark, brown and acrid. Discharges are offensive. Odor of green corn. Violent itching of vagina and vulva. Creosote in tylism in pregnancy or hyperemesis gravidarum. Nausea and vomiting of food several hours after eating. Vomiting of sweetish water in the morning. Bitter taste after swallowing the water. Great coldness in the stomach. Burning pain in the stomach and profuse tylism with sweet taste in the mouth. Ipecac in tylism in pregnancy or morning sickness. There is persistent nausea and vomiting. Persistent nausea not better by vomiting, thirstlessness, cravings for sweet, profuse tylism with vomiting, and tongue is clean. Apocynum in hydrocephalus. It is a good remedy for hydrocephalus. There is a hydrocephalus with open sutures, loss of vision and one eye, loss of vision of one eye, constant and involuntary motion of one arm and one leg, forehead projected. Zincum metallicum in hydrocephalus. It is a good remedy for hydrocephalus. There is heaviness and dullness in head. Patient rolls on the head from side to side, bows the head into pillow. Forehead is cold and base of brain is hot. Violent vertigo, falling to left when walking. There is paralysis of brain, automatic motion of head and hands. Apis mellifica in hydrocephalus. It is a good remedy for hydrocephalus. Patient rolling head from side to side, sudden shrill screams when walking or sleeping. One side of the body is twitching and the other side of the body is motionless. Bores the head into pillow and backward. Stupid state. Eyes very red, pupil is contracted or dilated and the face is flushed. Arsenic album in infantile diarrhea. Stool is yellow, black, bloody and rice watery. Stool is very offensive, having cadaverous odor. Cutting pain in the bowel with tenesmus. Burning in rectum and anus. Great prostration. During diarrhea, the patient is very much restless and anguished. Diarrhea aggravated at night. Chamomilla in infantile diarrhea. Stool is greenish, hot like chopped egg and Spanish. Stool is very offensive like rotten eggs. Baby is very hot and has irritable temperament. Baby becomes quiet only when carried. Diarrhea from anger. Baby cannot bear anyone near him. Baby cannot bear to be spoken. Belladonna in mastitis. Breast is hard, red and painful. Breasts are indurated as of stony hardness. There is throbbing pain in the breast. Streaks radiate from nipple to all over the breast. Swelling of the breast. Nausea and vomiting. Congestive headache and malaise. High fever with chill. Modality aggravated by motion, touch, lying down, better by rest, standing or sitting erect. Phytolacca in mastitis. Breast is hard and painful. Breast is purple in color. Breasts are indurated as of stony hardness. Breasts are irritable before and during menses. Mastitis with enlarged auxiliary gland. Cancer of breast. Swelling of breast. Nipple is very much sensitive, sore and fissured and is aggravated by nursing. When the child nurses, the pain goes from nipple to all over the body. There is no milk in the breast. Milk is thick, scanty and unhealthy and dries up. So with this guys, we end this video. So it was quite a long one. So it is under 30 minutes. So whenever you want to revise all the important pointers for therapeutics of obstetrics, which includes your 2 markers and 5 markers, you can always go to this video, revise all the important points, watch it once, twice or thrice, and thoroughly memorize it. So at least you can write something for the answer, and not something but a good amount of data for the answer, and it is quite well presented as well. So I hope this video helps you all out. Also, please do like this video, share it with your friends, and subscribe to our channel. It will motivate us to make more and more such videos for you all, and please do support us like you have been doing since so long. So I'll see you in the next video, which will be again covering some important parts for your third year. So until then, I wish you all the very best for examinations. If you are still feeling low, we have our study groups where we try to motivate and push everyone with some daily targets, important questions, notes, and etc. And all the notes of first BHMS, second BHMS, and third BHMS are already available on my Telegram channel, MedPerspect. You can easily find it. The link is in the description. So yeah, I guess that's that for this video. And until next time, goodbye and take care. Thank you and good luck.